Doctor, why should people get to know the function and health of their thyroid gland? I think it's probably one that's passed over quite a bit, I would imagine.
It's like saying, why should you want to know how to step on the gas pedal when you're trying to drive? Or get the thermostat in your house turned to back up over 40 degrees. The gas pedal determines, or the thyroid is your body's gas pedal. It determines how much energy you make. We have plenty of calories. You know, this is the first time in human history we have high calorie malnutrition. Most people are obese in the United States, not calorie malnourished. So what determines energy production is, do we have the machinery and nutrients and things we need to burn the calories, but also setting the thermostat or the gas pedal, into mode that says burn calories to make energy. So if your thyroid is low, you can't make enough energy. You'll feel tired.
Okay.
But other symptoms, achy, because muscles will get tight, brain fog, feel fuzzy, depressed. The weight gain is a common problem because you're not burning the calories. So, but one of the things people don't realize about is that if your thyroid, even if it's normal, but just low normal, where the doctor will say, oh, that test looks just fine. Low normal thyroid is associated with a 69% higher risk of heart attack death than having a thyroid be just in the high normal range. And if you think of statin cholesterol medications only lowering heart attack death risk by 1.2%, so, and let's put that in perspective, chocolate lowers a 25% optimized